Types of hypersensitivity, it includes type 1, type 2, type 3, type 4. Type 1, that is IgE mediated, otherwise known as anaphylactic. Anaphylactic, that means immediate response. Here what happens is antibodies are fixed on the surface of tissue cells, especially mast cells and basophils in sensitized individuals. The antigen combined with the self-fixed antibody leading to release of vasoactive substance that leads to clinical reaction. So in case of type 1, there will be antibody fixed surface cells that will react with the antigen, then leads to release of vasoactive substance that leads to clinical reaction. So type 1, that is example is anaphylaxis, and another example is ectopy. Ectopy means here the naturally occurring familial hypersensitivities of human beings, for example asthma, hay fever, etc. Here the antigens are the inhalants like pollen, house dust, ingestants, eggs, milk. All these may cause some reactions to the client, skin reactions, conjunctival reactions, systemic reactions. So these all are the type 1 hypersensitivity, that is anaphylactic or IgE mediated. Some two examples, that is atopy and the anaphylaxis. Type 2, that is cytotoxic or cell stimulating, IgG or IgM mediated. Here this reaction is initiated by IgG antibodies or the IgM that react either with the cell surface or tissue antigen. Cell or tissue damage occurs in the presence of complement or mononuclear cells. In the presence of complement or the mononuclear cells, there will be reactions. That's why it is known as cytotoxic or cell stimulating. Here type 2 reactions are intermediate between hypersensitivity and autoimmunity, and it takes hours to days to occurs. So in hemolytic reaction or hemolytic anemia, lysis of red cells caused by anti-erythrocyte antibodies in hemolytic disease of newborn is an example for type 2 reactions. Autoimmune reactions are examples for type 2 hypersensitivity. Next one, type 3. Type 3 is immune complex or toxic complex disease. Here, the damage is caused by antigen antibody complex. This may precipitate in and around small blood vessels, causing damage to cells, secondly on membranes, interfering with their function. So type 3 means it is mediated by immune complex or toxic complex mediated. It occurs at least 1 to 3 weeks. Serum sickness and systemic lupus erythematosus are the examples for type 3 hypersensitivity reaction. Serum sickness means, or Arthur's reaction also a example for type 3. Serum sickness means when we are injecting a single injection of high concentration of foreign serum such as diphtheria toxin that leads to a clinical syndrome like fever, lymphadenopathy, splenomegaly, arthritis, etc. So this syndrome that will be subsided by the 7 to 12 days, and this syndrome is caused by immune complex formation. So that is known as the serum sickness. Arthur's reaction is another examples for the immune complex mediated type 3 hypersensitivity reaction. Here, the initial injection had no local effect, but the later injections that cause intense local reactions like edema, induration, hemorrhagic necrosis. So this type of reaction is known as the Arthur's reaction. So that occurs in type 3 hypersensitivity. Next one, type 4 hypersensitivity. Type 4 is otherwise known as delayed or cell-mediated hypersensitivity. So here, this is cell-mediated response. The antigen activate specifically sensitized CD4 and CD8 T cells, leading to secretion of lymphokines with fluid and phagocyte accumulation. So, in case of type 4, here there will be cell mediated response, antigen specifically sensitized with the CD4 and CD8 T cells. That's why it is T cell mediated. So there will be accumulation of secretion of lymphokines, and fluid accumulation will also be present in type 4 hypersensitivity. And it takes days to weeks. The reaction, in order to occur the reaction, it takes days to weeks. Example is Sjogren syndrome, rash, tuberculin test, contact dermatitis. All these are the examples for the type 4 hypersensitivity. So, the types of hypersensitivity include type 1, type 2, type 3, type 4. Type 1 IgE mediated, type 2 IgG or IgM cytotoxic, type 3 antigen antibody, that is immune complex mediated, and type 4 T cell mediated, and it is the delayed hypersensitivity. Another traditional classification of hypersensitivity is the immediate hypersensitivity and delayed hypersensitivity. So, in immediate means it occurs rapidly and it is induced by antigen. There will be circulating antibodies present in the immediate hypersensitivity. Then passive transfer is possible with the serum, and desensitization is easy in case of immediate. But in case of delayed hypersensitivity, it appears slowly and it is progressive in nature, and it takes longer time. Here, the antigen may react intradermally or with the skin, and circulating antibodies are not so common in case of delayed hypersensitivity. Here, usually the cell-mediated response, and it cannot be transferred with serum, and desensitization is very difficult and it is long lasting. So these all are the classification of type classification of hypersensitivity. So, main classification is type 1, type 2, type 3, type 4, that is IgE mediated, IgM or cytotoxic, immune complex mediated or T cell mediated. Another classification is immediate and cell mediated. Delayed or cell mediated. Thank you.